on this week in response to COVID. So I always have to speak a little bit about what the business community is doing, and somebody recommended Jon that he had presented to their organization and actually helped them out. So I thought this was going to be a really good thing. Obviously, a lot of people are excited to hear what you have to say, because we're getting to that point, Jon, now where I think if you're not already back, they're starting to have conversations to go back. And as we were talking before, everybody got let into the room. One of a major Lorain County employer still, from their office workers has still not gone back to full time, and they're looking at it again at the end of May. So with that, I'm going to turn it over to Jon from Wickens, Herzer, and Panza, and I hope you enjoy. And if you have any questions, Jon, do you want them to throw their little hand up or just kind of blurt out, or do you want them to write a question in the chat? It's up to you.
Why don't we, if we have questions during the actual meat of the presentation, let's put them in the chat window.
Okay.
And then
Tammy can point it out to you. Yeah.
Yeah,
and
I'll see my little screen light up if if a chat comes in, and then I'll take a look, and then we'll either address them as they come, or I'll save them to the end. I'll kind of see how the flow of this goes. So
okay, sounds
good.
Thanks,
I did leave some time at the end for questions. So anyway, good afternoon. Thank you so much to the Lorain Chamber for hosting this and inviting me. I really appreciate it. A little bit about me: I've been a management side employment lawyer for almost 24 years. I've spent the entirety of my career representing employers in employment and labor disputes. And right around 14 months ago, when the world shut down, I made it my goal to also become a COVID lawyer. And so that's a lot of what I've been doing for the last 14 months has been advising employers on kind of the myriad issues that go along with navigating our way through the worst public health crisis I've seen in my lifetime, and I think we've seen, in little over 100 years. And now helping employers, businesses navigate their way out of the pandemic as infections and death rates fall, vaccination rates and immunity rises. We're starting to see the narrow light at the end of the tunnel, very long, very dark tunnel, I think open up more and more every day. And so the topic of the day, and really the topic what I've been spending a lot of my time talking to companies about for the last month or two, is what does the new normal look like post-pandemic? How do we start getting businesses back to thinking about what their operations are going to look like to bring employees back to work, and what safety protocols look like and whatnot? And so when I initially talked to Tony about kind of what this presentation was going to look like for you all today, I thought that this idea of kind of returning employees to quote unquote normal, whatever normal is going to look like, at the tail end, hopefully the tail end of this pandemic, and as we navigate through to a post-COVID world, what that's going to look like. So I put together a fairly ambitious agenda to talk to everybody about over the course of the next hour or so. I want to talk about vaccines, which is going to be a hot topic. Safety measures, kind of what safety measures we've had in place, what do we think can maybe fall by the wayside as we move through to this kind of post-pandemic world, what the future of remote work looks like. I think the number 4 is a topic that's not talked about enough, and I certainly, in the time we have today, won't have enough time to talk about it in a lot of detail. But I think that the next public health crisis coming after COVID is the mental health crisis that we're all going to be dealing with as we reintegrate into society, deal with the loss of family members, friends, loved ones, and just learning how to kind of be a society again around other people. And then I'll close out with some takeaways. Okay, I want to start with the COVID-19 vaccine, which is for many reasons both a hot topic and a a fairly, controversial topic. This is as of last Thursday, Friday, May 6th, whatever day of the week that was. I think that was Thursday a week ago. This is what the vaccine rate in Ohio looked like. There was 8.69 million doses given, um, a hair under 4 million Ohioans fully vaccinated, which represents 34.1% of the population of Ohio fully vaccinated. Starting tomorrow or Friday at the latest, the vaccine will become available to 12 to 15-year-olds. The FDA late yesterday approved Pfizer's application for an expansion of its emergency use authorization for the Pfizer vaccine to be given to 12 to 15-year-olds. The CDC is meeting at 3:30 this afternoon, or the subcommittee of the CDC, which is expected to recommend that the full CDC approve 12 to 15-year-olds to receive the vaccine. For someone like me who has a 12-year-old and a 14-year-old, one of whom is high risk, it's incredibly welcome news, which will let me rest a lot better knowing that my 12-year-old is going to be getting vaccinated soon. But the numbers are still concerning because even at 34%, even at 50%, even at 60%, it's not enough. We know that from just listening and reading the science, that we need somewhere around 80% of the population to be, to have immunity in some form or another for us to reach herd immunity. Now that 34% does not take into account the percentage of the population that has COVID-19 antibodies as a result of having the virus. And we don't really know what that, because of the prevalence of asymptomatic transmission, we don't know what that number looks like. Some people say you take the rate of infections we have, and some people say double it. Some people say multiply it by 10. We don't really know. But whatever it is, we're still short of kind of where we need to be for herd immunity. And equally troubling is the fact that because of vaccine hesitancy, that is people who just, for whatever reason, whether it's philosophical or political or religious or what have you, either don't believe in vaccines at all or don't believe this vaccine has been researched and vetted enough to take it right now, and just are not going to get the COVID vaccine right now. And so it's going to be a struggle for us to get to where we need to be for us to reach that elusive goal of herd immunity, to where we can say, yes, like COVID is officially over. We have enough immunity within the population where the disease is just going to naturally die out. What are employers and employees talking about around the idea of vaccinations in general? Employees, 66% of employees, and this is kind of a mishmash of statistics from various surveys, 66% of employees say they're worried about their health and safety when returning to work. 62% want their employer to mandate the COVID vaccine before allowing someone to return to work. And still 35% refuse to get the vaccine or are refusing to get it now. So, if 35% just won't get the vaccine, any way you slice those numbers, if the full 65% of the balance actually gets the vaccine, we're still going to fall short of where we need to be. In terms of employers, 44% of employers say they're going to require all employees to be vaccinated as a return to work condition. 63% are going to require proof of vaccination to return to work. And 65% plan to offer vaccine incentives. And we're going to talk about each one of those numbers and kind of what they mean from a legal standpoint and in terms of what employers can or can't or should or shouldn't do. The 44% number, I personally am a little skeptical of. I've seen that number reported or somewhere, plus or minus a few percentage points of that number reported in various places. So I'm comfortable with the accuracy of the reporting. Just anecdotally in my own practice, I haven't seen that. I haven't had a single client that has said to me, I want to mandate the vaccine. All of my clients are strongly recommending or encouraging it, but I have not yet have a client that has said, we want to, as a condition of either employment, continued employment, or as a condition to return to work, we are going to 100% mandate that that individual get vaccinated. Which brings us to the big question, which is, can employers mandate that employees receive the COVID-19 vaccine? And the answer is yes. Legally, an employer can mandate that employees receive the COVID-19 vaccine. So that 44%, if we believe that number to be accurate, is fine. Legally, those employers are within their right to say, yeah, we're going to require the COVID vaccine as a condition of employment. But there is a huge a huge asterisk, a huge set of exceptions that goes along with the yes, employers can mandate that employees receive the COVID-19 vaccine. And there are two large exceptions that go along with that rule. One related to reasonable accommodations for medical issues, and two related to reasonable accommodations for religious issues. Both the Americans with Disabilities Act and its Ohio counterpart, in Ohio's own Civil Rights Act, and Title VII of the Civil Rights Act of 1964, which prohibits religious discrimination, and its Ohio counterpart, require reasonable accommodations for, on the one hand, an employee's physical or mental impairment, and on the other hand, for an employee's sincerely held religious belief, practice, or observance. All of which means that if you have a mandatory vaccination rule, if you have a rule that says, yes, we are going to mandate that employees get vaccinated as a condition of employment, you have to allow for reasonable accommodation exceptions for either for an employee's underlying physical or mental impairment, if they have a doctor's note that says, because of so-and-so's underlying medical issue, they cannot receive the COVID vaccine, or if someone comes to you and says, hey, I'm a Jehovah's Witness, and we, as a matter of our religion, are not allowed to get, we don't take medicine, we're not allowed to get vaccines, therefore I need an accommodation. That is also an exception. A couple of things to point out, particularly with the religious issues. Title VII, the religious discrimination laws, don't just protect the big, the big three, right? Christianity, Judaism, Islam. It's really anything that surrounds a set of beliefs that can be identified as a religion qualifies as a religion that the law protects in employment. The law goes so far as to protect things like the Wiccan religion or Satanism or even atheism are all protected as religions under Title VII. And I have no idea if any of them have anything to do with the vaccine, but it's just my way to point out that the law, what you may think of as a religion, the law might go a lot more broadly to protect, but it doesn't protect as a religion philosophical beliefs, social beliefs, political beliefs. So if you have an employee who believes that Bill Gates developed 5G transmitters that the government is using through the government's implanting you through the vaccine, and therefore your employee says, I'm not getting the vaccine because I don't want the government tracking me through these Bill Gates designed and developed 5G transmitters that are being hidden in these vaccine doses. That's not a religion that has to be accommodated. It's a philosophical conspiracy, whatever belief that that person, it might be sincere, it might be genuine, but it doesn't mean you have to accommodate it. In terms of accommodations themselves, um, just because you have to accommodate an employee who can't get the vaccine because of a medical issue or a religious issue doesn't mean you have to let them come to work unvaccinated. There are many alternatives that you can consider to allowing someone to come into your workplace unvaccinated if you're requiring a vaccine as a condition of employment. You can continue a work from home arrangement. You can put them off in an area by themselves. You can change their work schedule. You can put them on a leave of absence until it is safe for them to return to work unvaccinated. The point is, for both the ADA and Title VII, the law requires that you engage in what the law calls an interactive process with the employee. You have to actually have a conversation with the employee, talk to the employee, figure out what their medical or religious issue is, and figure out what accommodations, if any, you can make for them that will allow them to go about and perform their job. So that's the can you mandate the vaccine? But just because you can mandate the vaccine as a condition of employment doesn't necessarily mean that you should. And to me, as a matter of best practice, I think the recommending to employees that they get vaccinated instead of mandating to employees that they get vaccinated makes sense for most employers. There may be exceptions. If you are a medical provider, you may feel strongly about your folks being vaccinated. If you are an educator, you might feel strongly about your folks being vaccinated. If you work in public service or public health, you might feel strongly about your folks. So there's reasons why you might want to mandate the vaccine depending on the industry in which you happen to operate. But I think in most cases, it makes sense to strongly encourage your employees to get the vaccine when they qualify to do so. And right now, everybody, and not just in Ohio, but nationwide, over the age 16 or over is eligible. It'll be, like I said, today or tomorrow or Friday, age 12 and over will be eligible. Encourage them to get the vaccine. And I say that for a couple of reasons. Number one, there is a real risk that even though you're going to have this, if you have this mandate in place, that because there are exceptions for medical issues and religious issues, that the exceptions might swallow the rule, that you might have so many employees that claim one of these exceptions that you may really undercut what you're trying to accomplish by having a mandatory vaccine in the first place. Secondly, if you mandate the vaccine, side effects that employees suffer from the vaccine become an OSHA recordable event. And while I don't think that's a massive deterrent, it is an additional administrative burden on an employer to track employee side effects from the COVID vaccine if you're mandating the vaccine, to track side effects and then record it on an OSHA 300 log if an employee experiences side effects related to the vaccine. And lastly, and I think perhaps the biggest reason why I feel so strongly about recommending the vaccine as opposed to mandating the vaccine is that I think employers really run a risk of alienating a certain group of employees if they tell employees what employees have to do with their bodies from a medical perspective. We know from the numbers we looked at before, there's 35% of the population that just does not feel comfortable getting the vaccine. If you break those numbers down further, 15 to 20% tell you they are never going to get the vaccine no matter what, and 15 to 20% will tell you that they don't feel comfortable getting it right now. And as I said, we need to get to 80%, give or take, to reach herd immunity. So we understand that 65% say they're going to get vaccinated. now or in the near or immediate future. We don't need to mandate the vaccine in order for that percentage of the population, that percentage of your employees to get vaccinated. But I do think that even though they're going to get the vaccine anyway, there is a certain percentage of them that you really, from an HR employee relations standpoint, you risk alienating. If you say, yeah, we understand you're going to get the vaccine, but we're requiring it anyway, they're going to feel that you are invading their medical privacy by telling them what they have to do. So you risk alienating a percentage of your employees that are going to get vaccinated anyway. You're never going to convince the 15 to 20% that are not going to get vaccinated that is the right thing to do. And so you severely risk losing them as employees. And then that 15 to 20% in the middle, again, you risk alienating a certain percentage of them through what they're going to view as an invasion of their privacy. So to me, rather than implementing a policy that's never going to reach the percentage of your employees that refuse to get vaccinated for whatever reason, and you risk alienating a percentage of your employees who are going to get vaccinated anyway, my recommendation when my clients ask me is that you should focus on that 15 to 20% in the middle, those that say, we're not sure it's safe. We might prefer to wait until it's fully approved and not just approved for emergency use. We don't think it's been studied or tested enough. Get them the information they need to help them make an informed decision that the vaccine is safe and effective, and that they should get it as soon as possible. The CDC has great resources right at cdc.gov for businesses to give to employees, detailing the development of the vaccines, the research around the vaccines, the science behind the vaccines, how they're safe, how they're effective, and why people should be getting these vaccines now. Educate your employees, arm them with the information they need to make an informed decision, and try and convince as many employees that are on the fence as possible to go ahead and get that vaccine. Also, while we're talking about mandates versus recommendations, proof of vaccination is always allowed. You can always ask employees, even if whether you're mandating the vaccine or not, you can always ask an employee to provide you proof of vaccination. Can you give us a copy of your vaccination record so we have it for your file? There's no legal issues with that at all. The follow-up question, however, you need to be wary of. If an employee says, well, I can't give you proof of vaccine, you can't ask the follow-up, why not? Because that then may cause the employee to reveal an underlying medical issue, which raises confidentiality concerns under the Americans with Disabilities Act. So the follow-up why question is actually illegal, but the please provide us proof of vaccination when you receive it is a perfectly legal question to ask, and a perfectly legal policy for an employer to implement. Few other points to make about vaccines. A lot of employers we saw in the survey are interested in providing incentive payments or gifts to employees as an incentive to get them vaccinated. Stay tuned. The legality of that practice right now is very much in doubt. The EEOC is supposed to be coming out with guidance very, very soon. It should have been out already, but it's not. No one really knows what it's going to say about whether or not incentive payments or gifts in exchange for a vaccine are legal. There is a question that the question is, if the payment or gift is too large, it becomes in the eyes of the Americans with Disabilities Act coercive. You can't coerce people to undergo a medical test or medical examination. And so for that reason, there is a question as to whether incentive payments or gifts are going to be legal at all, or if they are, kind of what size is going to be allowed versus what's going to be deemed overly coercive. For large employers, the CDC now allows large employers to plan and hold vaccine clinics right on site. So if you're a big enough employer and you want to get your folks vaccinated, you can actually bring someone right on site and have the vaccine clinic run right there. And the last thing I think employers need to think about is paid time off for employees, both to receive the vaccine and and for any side effects they may suffer from it. We really want to remove as many barriers as possible to employees getting vaccinated. We don't want employees feeling like they have to choose between getting a paycheck and getting a vaccine, if that's a choice they have to make, like people live paycheck to paycheck and they can't afford the day off to get the vaccine or a day or two to because they may have side effects. We don't want employees feeling that they have to make that choice. And so for employers with less than 500 employees, that is time for the vaccine and a vaccine related side effects is reimbursable via a payroll tax credit under the American Rescue Plan Act, which is the $1.9 trillion stimulus package that Congress passed earlier this year. If, and the big if there is if an employer opts in to the paid COVID sick leave program that's provided for in the American Rescue Plan. I think all employers, regardless of whether you fall under that American Rescue Plan paid sick leave provision or not, should be providing this paid time off to employees regardless, again, because we don't want employees choosing between pay and vaccines. We want to break down barriers. And so I think as an employer, I think it's a small price to pay to say, take your 2 hours, get your shot, and then take the next day if you need to, in order to incent as many people as possible to get vaccinated. Okay. Next, I want to talk about safety measures, kind of what the workplace looks like from a safety standpoint as employees come back to work, or if you've had employees either manufacturing, for example, and people have been in work since COVID started, or you're in a more office environment and you're thinking about bringing people back to work. What's that going to look like from a safety standpoint? State of Ohio public health orders are still in place, which still requires 6 feet of social distancing, still requires facial coverings indoors when outside one's residence and outside of distance is not possible, still requires non-congregating within groups of 10 or within groups of more than 10 people, separated from other groups by at least 6 feet. So you can't have more than 10 people congregated together closer than 6 feet to another group of 10. And then quarantine, that is if you've been exposed to someone with COVID, if you are fully vaccinated, that is 14 days after your second dose of Pfizer or Moderna, or 14 days after your shot of J&J. If you are fully vaccinated, you are no longer, per the state of Ohio, required to quarantine after an exposure to COVID-19 once you are fully, and the key there is fully vaccinated. OSHA, which is the federal agency that regulates workplace health and safety, has, in my opinion, really dropped the ball on OSHA since the pandemic started back in March of last year. To date, there is still no COVID standard relative or specific to COVID-19. There is a temporary standard that we are waiting to be released. We've been told it should be released any day now. That was like a month ago. We're still waiting for it to be released. When it gets released, it may be subject to a public comment period to where it might not be final even in its temporary form for 60 or 90 days after it's released. And by the time we finally get official OSHA guidance on COVID, the pandemic might be over. And so OSHA has, I think, really dropped the ball by not getting out in front of, again, kind of the largest public health crisis we've had in this country in 100 years. But it doesn't mean that OSHA's done nothing. OSHA does have its general duty clause, which covers all employers, which says that each employer shall furnish to each of its employees employment and a place of employment which are free from recognized hazards that are causing or are likely to cause death or serious physical harm to his employees. What does that mean? It means you got to provide a safe workplace to your employees, whether there's an OSHA standard that covers that, that specifically covers that hazard or risk or danger or not. OSHA has been out where necessary to under its general duty clause to address COVID issues. There's an employer in Florida that faced like $135,000 fine because it wasn't requiring its employees to wear masks while working. OSHA, under its general duty clause, even though it doesn't have a specific COVID or masking standard, said you have a general duty to provide a safe workplace. You're telling your employees, actively telling them, not only are you not to wear masks, but masks are prohibited to be worn in the workplace. You violated your general duty to keep your employees safe, and we're going to fine you as a result. And it was a large fine. That was in the neighborhood of $135,000. It's not to say that OSHA has done nothing during the pandemic. They did publish a couple of months ago a set of kind of return to work best practices, kind of things for employers to think about from a COVID standpoint, in terms of what their workplace should look like as people are coming back into work. We should expect, if and when OSHA ever does publish its standard on COVID, it's going to look similar to what OSHA has said it has kind of put forth as its return to work best practices. These are not binding. They're again, best practices. OSHA's not doing any enforcement under these best practices, but this is what OSHA thinks. These are the issues that OSHA thinks employers should be thinking about in terms of keeping their workers safe and healthy during the pandemic. They believe that employers should be assigning some kind of coordinator who's responsible for COVID issues on the employer's behalf, figuring out where and how workers might be exposed to COVID-19 at work. You don't have these things in place at this point. I'm not saying don't do them, but you're about a year behind the game, and you were a year behind the game really before OSHA even published these. Identifying a combination of measures to limit the spread of COVID-19 within the workplace, including isolation, quarantine, physical distancing, barriers, masks, ventilation, hygiene, and routine cleaning and disinfection, the kind of thing that Ohio's public health orders already require. Consider protections for workers at higher risk for severe illness through supportive policies and practices, things like work from home, which we're going to talk about in a second. So put a thumbtack in that for a second. Establish a system for communicating effectively with workers. How are you going to let your employees know if you're running a vaccine clinic, or that you have a vaccine requirement, or they might have been exposed to COVID in the workplace and should quarantine if they're not vaccinated? How are you going to communicate that to your workers? Instructing workers who are infected or potentially infected to stay home and isolate. Again, things we should have been doing since last March. Minimizing the negative impact of quarantine and isolation on workers by things like effective work from home policies, isolating workers who show symptoms at work, enhanced cleaning and disinfection, implementing protections from retaliation, and setting up an anonymous process for employees to voice COVID-19 concerns, making the COVID-19 vaccine or vaccination series available at no cost to all eligible employees. Well, there shouldn't be a cost because it's being paid for by the federal government, and providing information and training on the benefits and safety of vaccinations. We've already talked at length about that. And lastly, OSHA says, do not distinguish between employees who are vaccinated and those who are not. And I put big asterisks around that because that information that OSHA published just 2 months ago in its best practices guide is already stale, out of date, because the CDC has subsequently said that you can actually distinguish between employees who are vaccinated and those who are not vaccinated. The CDC recently updated its guidance for the fully vaccinated, which is again 14 days after your second dose of Pfizer or Moderna, or 14 days after your one dose of Johnson & Johnson. Individuals can visit with other fully vaccinated people indoors without wearing masks or physical distancing, visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing, participate in outdoor activities and recreation without a mask except in crowds, resume domestic travel and refrain from testing before or after travel or self-quarantine after travel, and then refrain from testing, quarantine, and screening following a known exposure if asymptomatic. And it's that last bullet point that's really important. If someone is fully vaccinated, they no longer have to quarantine. And we saw that reflected in the most recent version of Ohio's COVID-19 public health order. A lot of this guidance pertain because the Ohio's public health order was going to supersede a lot of this in terms of when you can wear a mask and when you can't wear a mask. Masks are still required in the workplace per the state of Ohio, with exceptions like if you're alone in an office or if you have a medical reason for which you can't wear a mask, or whatnot. The domestic travel is an interesting point that employers need to think about. Lots of employers suspended travel programs when the pandemic started last March, and the CDC has now given a brighter green light to the resumption of travel for business purposes, because individuals don't have to test before or after they travel and don't have to self-quarantine after they travel if they're fully vaccinated. So if you're looking for, again, reasons to get your workers vaccinated, you need to be thinking about, if they work outside, they can take their masks off. If they travel for you and they're fully vaccinated, they don't have to test and don't have to quarantine. And if they've been exposed, they don't have to quarantine, stay out of work for 14 days after that exposure. So while a lot of what the CDC had to say about this guidance for fully vaccinated individuals is more like, having people in your home, there are really some important implications here for businesses, as well. The CDC continues talking about what fully vaccinated people should continue to do, right? Take precautions in indoor public settings, like wearing a well-fitted mask and distancing. And we see that reflected still in Ohio's COVID public health order. Wear well-fitted masks when indoors with unvaccinated people who are at increased risk for severe COVID-19 disease, or who have an unvaccinated household member. Again, all reasons why the state of Ohio is still requiring masks to be worn in the workplace. Avoid indoor large-sized in-person gatherings, and then follow, most importantly, follow guidance issued by the individual employer. These are kind of baseline rules, what the CDC says it's safe to do or not do. And the state, as it has, or an individual employer can always adopt more strict rules as it sees fit. Okay. Moving on, I want to talk about what remote work is going to look like as we move out of the pandemic and bring people back into a physical workplace. I was saying to Tony before we started, the irony of this today is that I'm actually presenting from home because I have contractors in my house. And so while I've been back to the office more than I haven't been over the last 2 months, I'm actually home today because I have someone hanging drywall in my basement and someone needed to be here with the contractor. So but more and more businesses are bringing people back to work. And I have 2 slides here just to show you where the divergence of thinking might be. What employers are thinking, and then what employees are thinking, and then what employers are thinking about the future of remote work versus in-person work. 58% of workers say they would absolutely look for a new job if they weren't allowed to continue working remotely in their current position. 65% want to work remotely full-time post-pandemic. 33% prefer a hybrid work arrangement, and only 2% prefer to return to the office full-time. And why do so many people prefer either full-time remote work or a hybrid arrangement? Just about half are afraid of a COVID-19 exposure or infection. 46% are worried about having less work flexibility if they're required to return full-time. And then 43% prefer or fear having less work-life balance. Although to me, I think you have less work-life balance when you work remotely, because you no longer have the physical separation between the workplace and your home. when your office is your home, you tend to fall into a trap of working around the clock. You get up at 7. Whenever you get out of bed, you go downstairs, fire up the computer, um, you know, drop the pod and the Keurig and start working. And then and you work and work and work and work and work. And then sometimes you don't turn it off until you go to bed at night. And then you wake up the next day and it starts all over again. And now it's Saturday. And typically, I wouldn't work on a Saturday because I'm not going to go into the office. Now you're in the habit of working on your couch or working at your kitchen counter, or I'm sitting up on a chair in a spare bedroom, or wherever you work from your home. And so when you lose that physical separation, you do risk blurring the line between work and home, or work and non-work, and then working more as a result. What are employers thinking? 83% of employers say remote work has been successful. And that could be because employers have decided that they're getting more productivity out of their workers at home because they're home, again, because of that blurring of work versus non-work. 66% are planning to allow employees to work from home full-time, at least through 2021. 73% intend to offer some flexible work arrangements when the pandemic is over. Only 21% of employers believe that employees should be in person full-time 5 days a week. 52% say productivity is improved, and 70% are planning to make investments to assist in either full-time remote or hybrid working arrangements, digital infrastructure, computers, and whatnot. So, and maybe divesting some in some investments by shedding real estate, right? Losing office space, what have you, because they just don't need that physical footprint anymore in a full-time office space. So I think the takeaway from both employees' views of remote work and employers' views of remote work is that remote work is almost certainly here to stay in one form or another. It might be industry specific. This is what work has looked like during the pandemic by industry. Those who have worked remotely or want to work remotely. And you can see on the high end, you have IT and technology. And again, these are largely kind of the white collar positions that are on the top end of the have worked or want to work remotely. The vast majority, IT, analytics, consultant, marketing, arts and creative folks, science, law, etc., are all more than aren't have worked remotely, and most want to work remotely. And then when you get down towards the bottom of the chart, things like retail, health and medicine, manual work and manufacturing, where it's very difficult to do these things remotely. You see much less who have been able to, and while still a majority would like to, the reality is they just can't because of the nature of their work. One question that keeps coming up is, what does the future of remote work look like for those who have a quote unquote disability and request remote work as an accommodation? And one fear that I've heard from employers over and over again is, we've been working remotely for the past year. If an employee in the future asks for remote work as a reasonable accommodation for disability, even though we're bringing them back to the office, or we tell them you have to come back, and they say, well, I've been home for the last year working remotely, I just like to continue doing that as a reasonable accommodation. Are we boxed in? Are we going to be able to deny a reason? Are we going to be able to deny an employee a requested work from home accommodation because it's worked for the past 12, 13, 14 months? On this issue, the EEOC did recently weigh in. It's had a document, it's updated constantly for the past year on pandemic issues. And in one of its most recent updates, the EEOC specifically said that just because an employer grants remote work to employees during COVID does not mean that the employer automatically must grant remote work as a reasonable accommodation after recalling employees to the work site. Each request for remote work as an ADA reasonable accommodation requires a separate interactive process. Remember, we talked about the interactive process when we were talking about vaccines earlier, and a separate analysis, and is always fact specific. There are no automatics, no guarantees here. If the post reopening request would excuse an employee from performing an essential function of his or her job, then continued remote work can be denied as an accommodation, because the ADA never requires an employer to eliminate an essential function as an accommodation. The accommodation has to make it so that the employee can perform the essential function, not removing the essential function from what that employee must do on a day-to-day basis. And temporary work from home during a global pandemic, the agency says, does not permanently alter a job's essential function. So just because pre-COVID you required in-person, someone to be in person as an essential function of their job, they work in teams, they work collaboratively, you can't do it remotely, whatever. Just because you've allowed temporary work from home for everybody, or groups of people during COVID, as a temporary allowance because we're dealing with this global pandemic, global health crisis, doesn't mean that you've altered the essential function of one or more jobs. You've got to take each request as it comes on a case-by-case basis, engage the employee in the interactive process, figure out why they're asking for remote work and whether being in person is actually essential to what they do, or can they perform that essential function remotely. Again, it's case by case. It's really fact specific, and you really got to kind of dive in and engage interactively with the individual to figure out whether or not they need to be there, they need to be in person, whether that is actually essential to the job, or can they perform their jobs and that job's essential functions remotely. The point is, just to close the loop on this, that just because you've had folks working from home for the past 14 months because of COVID, doesn't mean that you have forever permanently altered the nature of your jobs as to allow for remote work. You're the employer, it's your discretion. You determine what is the essential function of your jobs, and it's up to you to make that determination within reason. The bona fides of the job have to bear it out. But if the bona fides of the job say, yeah, in-person work is required, then for that individual, work from home, remote work, telework is likely not going to be a reasonable accommodation. I've covered most of this already. I just want a couple of points I want to make. Number one, if you are denying a work from home request because of performance issues that an individual has had during the pandemic, your productivity has been down, you haven't been able to reach you when we need you, you're not that responsive, whatever, are those performance issues documented, such that if you have to defend in court your denial of a work from home accommodation to a continued work from home accommodation to a disabled employee after you recall employees back to your physical workplace, are those performance issues sufficiently documented so that someone like me can then defend them in court? Or are we just going off of a manager's or supervisor's word of issues that are not sufficiently detailed and documented in the employee's personnel file? And then the only other point I want to make that I haven't yet made is that mandates and inflexibility are real big ADA red flags. Like the interactive process, it's a real legitimate thing, and you have to go through it when an employee makes a request for an accommodation, whether it's to a vaccine mandate or a recall to in-person work or whatever they're asking for an accommodation for. You have to engage in the interactive process. And if you are just knee-jerk saying no, you're not engaging with the employee, you're not having a conversation, and you are just rigid and inflexible, it is an ADA violation. And so when I say you have to engage in the interactive process, it's because the law says you have to. And if you don't, you've almost certainly committed a violation of the ADA. All right, lastly, before I wrap up with some takeaways for everybody, I want to talk about employee mental health. I do think, and again, we can really only barely scratch the surface on this issue, but I really do think that mental health crisis is the next public health crisis we're going to be facing. And I think we're already facing it as people have been isolated and alone for the past 14 months, including your employees. 31% of employees report symptoms of anxiety or depression related to the pandemic. 13% report having started or increased substance use, either alcohol or drugs. 26% report stress-related symptoms, and 11% of employees report having serious thoughts of suicide in the past 30 days. These numbers are, these are eye-opening numbers of the issues that people, including including but not limited to your employees, are dealing with as the result of COVID. Just some things to think about from an employee mental health perspective or mental health perspective for your employees. To make sure that your insurance benefits that you provide to your employees adequately provide for mental health counseling and treatment and substance abuse counseling and treatment. Do you have an employee assistance program? And if not, this would be a great time to look into starting one. Do employees have adequate paid time off and other leave allotments to take the time they need to deal with mental health issues? Or if they just need like a mental health day to gather themselves, is that available to them? Or do they not even have the ability to take time for themselves? Getting people talking about these issues, town hall, other employee meetings, focusing on mental health awareness so that employees understand what the issues are, understand that like there are benefits available to them, counseling, EAP, other benefits they may have to help them, people they can talk to, and so that they know that you as their employer take these issues seriously. Really will go a long way to help alleviate a lot of the stress that employees feel around these issues. Foster a sense of community among your employees to kind of break through the isolation. This is, as the world opens up, this will become less of an issue, but the things that we used to do as workplaces, don't exist anymore. The parties, the happy hours, the gatherings, the birthday cakes in the lunchroom, the gathering around the water cooler or the coffee machine in the morning to catch up with your coworkers and just chit chat or whatever, don't exist or haven't existed for a long time as people have been working remotely. And so things you can do, whether it's virtual happy hours, we're on Zoom today and I get it, but we are all a bit zoomed out after 14 months. But the things you can do virtually or otherwise to help foster a little bit of community within the workplace, and then the little things do go a long way. Here's a $25 Amazon gift card. You've been working really hard. Thank you very much. Here's a credit to DoorDash, order yourself a meal. Those kind of things for people that are stuck at home, working from home, through no choice of their own, really go a long way to helping people out. Lastly, some takeaways. I have three big ones that kind of cut across everything we've talked about. Number one, be flexible within reason. I've read a lot lately, partly because employers are so desperate to find workers, because the stimulus checks and unemployment stimulus and other things that have a lot of people, including myself, feel have created a disincentive for people to want to work. We know some industries, particularly, it's hard to find people to work. It's led to some feeling that maybe the employees have too much power, too much control now. And so when I say be flexible, that is kind of meet employees where they are on these issues. Everybody has their own kind of sense of personal risk, what they're comfortable with, whatever surrounding COVID. And so you want to be sensitive to what employees need. You want to be flexible and kind of meet them where they are, but it's got to be within reason. And you can't allow your employees to kind of rule the roost to control the issue here. If you're bringing people back to work, you're bringing people back, and you can't have the employee who says, I want to keep working from home. If there's not a legitimate, like a medical reason for them to continue doing so, for the reasons we've already talked about, you can't allow employees to have the control over where they work, when they work, how they work. They're your employee. You have the final say in that, but I do think there is a certain measure of flexibility that has to go into kind of where we're meeting employees on these issues. Openly communicate with employees on these issues around vaccines, around return to work. Nobody likes surprises. If you're going to mandate vaccines, have the conversation with your employees as to why you're mandating the vaccine. If you're bringing people back to work, communicate to employees as to why you're bringing them back to work, what you're doing to keep them safe, whether it's from a vaccine standpoint or a masking, distancing, cleanliness standpoint, whatever it is. A little communication over these issues goes a long way. And your employees want to know that you have their best interests at heart. The best way to do that is through communication with them. And lastly, have a policy. I think it's vitally important. We're all dealing with very kind of uneasy, uncharted waters, even a year plus into the pandemic. And so whether it is a return to work policy or a remote work policy or a vaccination policy or a combination of all the above in a COVID reopening plan, put it in writing, detail it for your employees so they understand what the rules of the road are going to be moving forward. I think it's vitally important to have that conversation and then to put it in a policy that everybody can refer to on black and white on a piece of paper so everybody knows what the rules are. And if you need a policy like that drafted for your workplace, I happen to know a good lawyer who can help you with it, who's written lots of them for lots of employers. Just saying, that's my only pitch, separate from all the information I've given everybody today. Flexibility, communication, put it in a policy. If you don't remember anything else I said today, I think those three are good signposts to kind of help you navigate through whatever the new normal is going to look like as we come through on the other end of the pandemic. And so with that, I'm going to take a break. I'm going to gather myself. I do want to open it up for questions. I don't see any in the chat. If people have questions, I know we're right at the 1 o'clock hour.
Yeah, usually, John, I usually at this point, I would just say, unmute yourself and ask a question. If people have to leave, thank you for coming. I think you provided an immense amount of information. I think it's been great. The only thing that I would disagree with you on was, instead of buying an Amazon card, buy a gift card to one of our local businesses.
Tony, you are 100% correct. You are 100% correct.
Definitely make sure you get one of those gift cards to one of our local businesses.
Yes, not a big box story. A fine, yes,
but
Lorain County,
else,
a Lorain County small business. Support our small businesses.
So, yeah. Any questions, guys?
There is I see there is slides in the chat. Someone said they had trouble finding them in the chat, and that's fine.
Maybe can you repost it then, John?
I can repost it. I will also email them out afterwards as well. So I will do that as well, so everybody has them.
As the year ended last year, I was interviewed from one of the local papers, and the one thing that you touched upon that I said had not reared its ugly head yet was the mental health issues that are going to be coming, and that we're all going to have to deal with, and we're probably going to have to deal with it for a long, long time. And hand in hand with mental health is substance abuse too, because I think they're hard to separate at this point. So I always encourage. We do the safety council here at the chamber, and as employers, keep an eye out on your employees. Whether they're in person or remote, and just make sure that they're doing okay.
Yeah, absolutely. I want to add, for people that haven't checked out yet, and it will be in the slides as well, but this is how to contact me. I don't hide online. I write about this stuff 5 days a week over at the Ohio Employer Law Blog, which is for the past 14 months been rebranded as the Coronavirus Law Blog. They both take you to the same place. But I do write about these issues Monday through Friday All my contact information is in the slides, and I'm happy to chat with anybody about these or frankly, any employment related issues that people are having.
So if there's no questions, John, I'll thank you from on behalf of the chamber and all the people who attended today. And obviously there's how you can get a hold of them if you need additional information, or if you just want, if you're not comfortable asking the question out loud, shoot John an email or pick up the phone and give him a buzz.
Absolutely.
All right, guys, thanks for coming.
Awesome. Thank you so
Yeah.
much. I really appreciate it. Take care,
Thanks.
everyone.
Thanks, John.